If you've done years of therapy, if you can explain your childhood better than your own therapist can, if you understand exactly why you are the way you are and you still flinch at the same things, still shut down at the same arguments, still feel like an 8-year-old in a grown body when someone raises their voice, this video is for you. Because understanding your trauma and healing your trauma are not the same thing. And there's a reason talk therapy can only take you so far. So here's what nobody tells you in therapy: your brain doesn't store memories like a diary, it stores them like weather. Some memories are just facts. You remember them, but you don't touch them. Other memories are still storms. You don't remember them so much as you relive them in your body, in your reactions, in the way your chest tightens before you even know why. Talk therapy is really good at helping you understand the story. Why your father's silence taught you to disappear. Why the way your mother left the room taught you that love has an exit. You can know all of that perfectly, and still your nervous system doesn't get the memo. That's because the part of your brain that's still bracing for danger doesn't speak in insight. It doesn't care about your therapist's excellent reframe. It speaks in body, in sensation, in split second reaction. And insight alone rarely reaches it. That gap between knowing and healing is where most people get stuck. And if what you went through wasn't one bad night, but years of it, there's a name for that. And it changes everything about how healing actually has to work. This is EMDR, eye movement desensitization and reprocessing. Say that once. Forget it. Just call it EMDR. Everybody calls it EMDR, including your therapist. So here's the theory in plain language. When something overwhelming happens, especially when you're young, or when it happens over and over, your brain sometimes doesn't file the memory away properly. Most memories get processed while you sleep, especially during REM sleep. When your eyes move rapidly back and forth, that movement seems to help the brain take a raw emotional memory and file it into the past where it belongs. But some traumatic memories can get stuck before that filing happens. They stay live, unfiled. So your brain keeps treating them like they're still happening, which is why a smell, a tone of voice, or a certain kind of silence can drop you right back into that exact feeling you had back then, even though you're safe now. EMDR uses bilateral stimulation to eye movements, alternate taps, or alternating tones to essentially recreate what your brain does naturally in REM sleep, but while you're awake and while you're guided by your therapist. You bring the memories to mind, your brain, with this extra support, finally does the filing job that it couldn't do before. So think of it like a filing cabinet where one drawer just got jammed. The memory isn't lost, it's just stuck half open, still active, still reachable by anything that resembles it. EMDR doesn't erase the file, it helps your brain finally close the drawer. Now, here's where most explanations of EMDR stop, but where your healing actually needs to begin. PTSD, as most people understand it, usually points to one event. So a crash, an assault, a single identifiable night that everything can be traced back to. But if what shaped you wasn't one night, if it was years of a parent who was unpredictable, or a home where you had to stay small to stay safe, or a relationship where you were slowly worn down instead of stuck all at once, that's complex PTSD. And this is why so many people with complex PTSD feel like therapy doesn't work on them, because most trauma processing methods want a target, a moment, a worst day. But you didn't have a worst day. You had 1,000 small ones stacked so evenly you can't even see where one ends and the next one begins. So there's nothing to point to, which makes you feel like there's nothing to treat. So you sit in therapy, understand everything, and still feel stuck. Not because you're broken, because the method didn't fit the shape of what happened to you. This is exactly where EMDR becomes different. It doesn't require one clean memory. A skilled EMDR therapist can work with a body sensation, that tightness in your throat when you're about to disagree with someone, a belief like, I'm too much, I'm not safe. If I need something, I'll be abandoned. To a pattern, the way you always brace, always over apologize, always leave before you can be left. EMDR can process the felt sense of childhood, not just a single event from it. That's why it's one of the few approaches built to actually reach complex PTSD, not just PTSD. If you've been doing the work, understanding the work, and still feel incomplete, this might be the piece that was missing. Not because you didn't try hard enough, because you needed a method built for years, not a night. So, what's this actually look like in the room? Well, a session usually starts with identifying a target, so a memory, a belief, or a sensation you want to work on. Your therapist will ask what comes up in your body and what negative belief feels attached to it, something like I'm powerless or I'm unlovable. Then comes the bilateral stimulation, usually your eyes following your therapist's finger or a light bar back and forth, sometimes alternating taps on your knees or your hands or with little things that pulsate. And you hold the memory in your mind lightly and just notice what comes up. Images, feelings, body sensations, sometimes even other memories that you didn't expect. You're not asked to narrate every detail out loud. You don't have to perform the trauma to heal it. Your therapist will check in between sets and ask things like, what are you noticing now? And you just keep going until the charge on that memory decreases. So the goal is not to forget it. It's for the memory to become something that happened instead of something that's still happening. So sessions usually end with grounding, making sure you leave regulated, not raw. And for complex PTSD in particular, this often isn't a one and done process. It's steady, paced work, memory by memory, belief by belief over time. And there's also a lot of prep work that goes on ahead of time to make sure that it's not destabilizing. So sometimes people call me and they ask me for EMDR and they want to jump in the first session, and that's not how it works. So, is this right for you? Well, to be honest with you, EMDR isn't a magic switch, and anyone who promises you one session and you're healed isn't being straightforward with you. So it's not hypnosis. It's not about erasing memories, and I've had people ask me for that too. It's a structured way of helping your brain finish something it started but couldn't complete on its own. It tends to be a strong fit if you've already done cognitive or talk therapy and plateaued, so you understand your patterns intellectually but can't shift them. It's also often used for chronic anxiety, hypervigilance, and the kind of relational patterns that keep repeating no matter how many times you tell yourself this is going to be the last time and this time is going to be different. And especially with complex PTSD, it matters who you do this with. Look for a therapist trained specifically in EMDR for complex or developmental trauma, not just single incident PTSD. The pacing, safety, and stabilization work look different when the goal is years of accumulated experience, not one event. So here's one sentence to take with you. EMDR doesn't erase the memory, it changes your relationship to it. If you spent years understanding your trauma and still feel like you're carrying it the same way you did when you were 8 or 10 or 15, that's not a failure of insight or therapy. It's a sign you might need a different kind of processing or therapy, not more explaining. So if this helped make sense of something you've been feeling but couldn't name, let me know in the comments. I'll read them all. Thank you all for being here. Appreciate it. And I'll see you on the next video.